All right, so we're going to go ahead and get started. Once again, good morning, and thank you for joining us today for the current state of Hoosier Youth 2021 Youth Risk Behavior Survey Findings webinar hosted by HCET with presenter Kate Schedel. My name is Bailey Schroeder. I'm a training manager here at HCET, and I will be moderating the webinar today. Let me first briefly introduce you to healthcare education and training. HCET's mission is to provide comprehensive program development, education, and training to improve reproductive and sexual health outcomes. HCET is an organization of passionate people who are proactive in their belief that access to evidence-based, medically accurate reproductive and sexual health education, training, and care is a fundamental right. This webinar has closed captions available. To enable them on your screen, click the live transcript button there at the bottom of your Zoom window. Then you can click show subtitles. You can also change the settings by clicking the subtitle settings. For more information and to keep up to date with HCET events, please be sure to follow HCET on all of these various social media platforms and visit our website at hcet.org. For additional training and professional development opportunities, you can also visit our virtual learning website at learn.hcet.org. Now I'm just going to quickly review some housekeeping information. A link to complete the evaluation will be sent following this webinar. You can visit hcet.org to view our archived presentations and a list of upcoming events. If you have any technical difficulties during this presentation, you can contact me at the email listed here on your screen. Nobody with the ability to control content of this activity has a relevant financial relationship to disclose within an eligible company. Throughout the presentation today, we encourage you to send any and all questions to the Q&A box. To submit a question, you'll just hover over that Q&A symbol there at the bottom of your screen. Then you can send a question at any time during the presentation. We will likely save all questions till the end, but go ahead and send them whenever they come to mind, and we will get to them at the end. So now I would like to introduce you to our presenter for today. Kate Schedel launched her career in global health by researching infant and maternal mortality in the Dominican Republic, strengthening health systems alongside communities in Guatemala, serving as a Peace Corps health education volunteer in Albania, and setting up primary care clinics and public health prevention programs in South America. After years of working overseas as a public health professional, Kate is committed to improving infant, child, adolescent, and maternal health in Indiana. She is currently serving as a programs director for the Division of Maternal and Child Health at the Indiana Department of Health, and is passionate about identifying gaps and improving the health of Hoosiers through community-driven work. She holds a bachelor's degree from the University of Michigan and a master's in public health degree from Yale University. In her free time, Kate is an avid reader, enjoys working on home improvement projects, and loves being an aunt. Without further ado, I will pass things over to Kate.
Thank you. I'm going to go ahead and start screen sharing. All right. Thank you so much for having me. Excited to be here today. I just would like to share the results of the YRBS with everyone as much as possible. So glad to be here. Just to get us started, I want to share a little bit about the Department of Health. The State Department of Health does have a lot of teams here that work with adolescents in various ways and young adults. But the state adolescent health administrator position sits on our team. So if you work with or know Lindsay Williams, she is in that role now. Sam Munt is our newest addition to our adolescent health team. We have a lot of programming that serves teens in some way. Our biggest one is through our Title V Maternal Child Health Block Grant. It is a formula grant that all 59 states and jurisdictions have. And it's nice because we get to work alongside them to advance adolescent health in Indiana while everyone else is sort of doing the same thing. We have 4 major objectives in Indiana that are around adolescent health in general. We also have 2 big grant programs, the Teen Pregnancy Prevention Grant Program and our Sexual Risk Avoidance Education Grant Program, that our partners are serving and working along youth in and after school. And then our team conducts the Youth Risk Behavior Survey and the School Health Profile Survey, which I will talk about today. And then lastly, our team in July launched our first statewide youth advisory board. I'll just mention at the very end. So to get us started, the Youth Risk Behavior Survey, which we call the YRBS, is a Centers for Disease Control and Prevention survey. It has been around since 1990. They have the questions and the formula down to a T here. So we as states conduct this every odd numbered year. And so we are in high school surveying students. We're about to do it again in 2023 from January through April. We always conduct the survey with this representative group of high school students around the state. We ask about 99 questions is our maximum that we can ask, and students do complete this in 1 class period. All surveys are anonymous. They are able to answer all or just some of the questions on the survey, depending on how they feel. Indiana, we use about 2/3 of what is provided to us, and then we add additional questions that we'd like to know here in Indiana. In 2021, that meant we added, for the first time, 8 ACEs or adverse childhood experiences related questions and some others that I'll share toward the end of the presentation. Mainly the survey is asking teens about risky behavior. Are they using substances? Are they using tobacco? Are they engaging in risky sexual behavior? Are they getting a well-balanced diet? Are they participating in physical activity? A lot of different things. Every school that we ask to participate, we do reward them with a $500 stipend for just participating. And then you can see sort of on the right-hand side, the way that we pick our schools is sending a giant sampling frame of all public high schools in Indiana to the Centers for Disease Control. We select 50 schools that take the YRBS. We do oversample for minorities to make sure we are represented in all different races and ethnicities in our responses. We do the draw at the same time as our youth tobacco survey, which is conducted by another team here at the Department of Health. So every year, about 110 schools of our 300 total schools are selected for one survey or the other. And when we survey a school, we always do a random selection of classes. So really, we are surveying about 2 to 6 classrooms per high school with this one. Now, if you see any data with a white background, that is from the YRBS. If you see any data with a blue background, this is from our School Health Profile Survey. The School Health Profile Survey is conducted during even years, and this is really a survey that goes out to middle school and high school staff around the state. Each school is asked questions about health policies and practices, so that could be anything from, do you have a school-based clinic? What services for health are you providing to your students? What sort of policies do you have around bullying, around tobacco use, around vaping? Or what are your requirements for health education in gym class? So everyone that participates in this one does get $25 as a gift card. Same sampling frame thing here on the right-hand side. We have about 700 schools between middle and high schools. We generally get between 350 and 400 schools selected for this one, and we actually send 2 surveys to each school, one that the principal answers and one that's either for a lead health teacher or a nurse. Just before diving into the data, I want to share that we are shouting from the rooftops that we have weighted data in 2021. And what that means is this information that I share can be representative of teens across the state of Indiana because we had enough participation. Unfortunately, in other years, we did not have enough participation from our schools, which means as you look at these trends, you will see years missing in 2013, 2017, and 2019. Yes, the last time we had weighted data was 2015, so you will see increases and decreases over a 6-year span. Same for school health profiles. There is some missing data there as well, but less of it. Most of this data was collected as students were coming back to in-person learning out of the pandemic. So again, think January through April of 2021. We don't know if the increases or decreases were really a result of COVID or not, because we were missing those 2 previous cycles. But we are hopeful to get weighted data in 2023. Anything that has less than 30 responses, those numbers have been suppressed due to low count. And then just keep in mind what the percentages are on the X and Y axis as we move through this. I am always happy to present this data, even if it is to like 3 people. I just want everyone to know it and share it. So any requests can come to this general inbox or to me at the end of the presentation. You'll have my email as well. Okay, so our sample, like I said, the CDC has a very set in stone formula for how they can get to weighted data. We surveyed just over 1,000 students in 43 public high schools in spring of 2021. We had about 88% of our total schools respond. Of the students that were selected, some might have been absent from class or some might have chose not to take it. Our student response rate was 81% and our overall response rate was 71%. Generally, you need at least 60% to weight the data. These results are representative of students across the grades. When they weight the data, you can see here, it shows about 50% male and female responses, about an even split between 9th, 10th, 11th, and 12th grade, different ages, and a span of races and ethnicities here. And then we ask one more demographic question around sexual orientation for all students. You can see in this slide, 76% of our youth identify as heterosexual, 4.5% as gay or lesbian, 10.7% as bisexual, 2.8% said I describe my sexual identity in some other way, and 4.4% said I am not sure about my sexual identity. We had 1.6% of our students say I'm just really not sure how to answer this question. And I will say we do not have one on gender identity. So we do have sexual orientation here. So I always like to start with a general health and healthcare slides. I'll talk a little bit about some things that we've improved upon in the past 6 years. And then I'm going to end the presentation with some topics that I think really important that all of us pay attention to, especially those of us that are working with or alongside any youth. So just to start off, about half of our students describe their health in general as excellent or very good. Keep in mind, these are teens, so I always expect that to be a little bit higher, but we then also ask questions specific to both physical health and mental health. About 52.9% of students said their physical health was not good, and about 30.7% of our students indicated that their mental health was not good. We also ask how often they are seeking help from a doctor. So we have 64.6% of our students say, I go to the doctor for a regular checkup, not just when I'm sick or injured. So what we refer to as an adolescent well visit. And more than that, about 71% of our students are going to the dentist for a regular checkup as well. What I like to contrast that with are these 2 bottom statistics. Just 17.9% of our youth are getting 8 or more hours of sleep on an average school night. And then 78.6%, which is so high, as we know, of students are spending 3 or more hours on a screen time. So some electronic device, and that is not time spent on doing schoolwork. So that's school plus homework plus 3 plus more hours on a phone or a computer or gaming after that's all done. You can see here we ask our principals, hey, do you have a full-time registered nurse at your school? We have seen this increase in the past 12 years. We went from about 63% in 2008, a steady incline to 82.2% in 2020. We did get weighted data in 2022, but are still awaiting those results. So I will add them in as we go. When it comes to physical activity here in Indiana, we had about half, 45% of our students saying, I'm physically active at least 60 minutes per day on 5 or more days. A smaller percent of students, around 19%, said, I'm physically active 60 minutes on all 7 days of the week. And then we had about 11% of our students who said, I'm not even meeting 1 day of 60 minutes of physical activity. We further ask, are you attending a gym class or physical education class? 41.7% of our students, they're attending at least one gym class a week, maybe more. 25% of our students are participating in gym on all 5 days. If I have a further breakdown of the data, I'm going to share it with y'all. So you can see here, most students in high school that are participating in these gym classes are likely in their freshman year of high school. More participation, as you can see here, among our male youth as well. And I'm going to flip this to show you what the principals said in their survey. What gym classes are required at your school? And you can see here, 93% of our schools require a gym class in the 9th grade, just 44% in 10th grade, and then just about 20% of our schools require something in 11th or 12th grade. Some good news here, we ask about, is there an opportunity to participate in physical activity, either at like the gym or weightlifting before the school day? We've seen a pretty steady incline here of schools offering some other services to our student. And then we also ask our teachers here if they are providing a way for students to be physically active in classrooms during the day. Seen an increase from about 26% in 2012 to 43% in 2020. All right, I'm going to talk a little bit about our tobacco use situation here. We see just 4.2% of our students smoking a cigarette at least 1 day in the month, 1.1%, and even smaller percent smoking around 20 days a month, and just 0.7% of our students are smoking cigarettes daily. This is a trend that we love to see, especially our tobacco team here have seen a pretty sharp decline in students over the past decade who are smoking cigarettes daily. We also chose to ask about vaping here in 2021. Unfortunately, we have a higher percent of youth vaping. So 19.8% of students are either smoking cigarettes or using a vape. 19.1% using it at least one day, 5.8% of our youth vaping about 20 days of the month, and then 4.2% of our youth are vaping daily. And this is new questions. So you can see here, started in about 2014, we started asking about vaping. This has steadily increased over time. We've actually seen a decrease in males vaping and an increase in females vaping. We also ask schools if they have a policy around tobacco-free grounds. And you can see here, this has increased a little bit over the past 10 years. About 65% of schools have a tobacco-free environment mandate. You can see that green line in 2014. More of our schools started adding in a tobacco-free environment that include vaping. So you can see here, very similar line in 2020. But please note, I mean, 65% of our schools have this, but that is not anywhere near 100%. We also asked our teachers, hey, are you still teaching about tobacco use and prevention? Again, pay attention to that y-axis, a decrease, not a huge one, but from 98% of teachers teaching this in 2010, 2008, down to 92% in 2020. When it comes to alcohol use, you're going to see some of the same trends. We have about 20% of our students currently drinking alcohol, at least one drink of alcohol, at least one day, the 30 days before the survey. 10.7% had early initiation into alcohol use, so that's before age 13. And about 10.5% of our students said they were binge drinkers. So that's defined as 4 or more drinks in a row if you're a female, 5 or more drinks in a row if you're a male, within a couple of hours. And just a note here at the bottom, around 40% of our students who are drinking alcohol got it by someone giving it to them. You'll see, like smoking, we've seen a pretty steady decline over the past decade. We also asked our youth around questions around marijuana use. So we can see here about 27% of students have ever used marijuana, with about 15% of those currently using marijuana. Just 5.7% have used synthetic marijuana or spice, and about 4.4% with that early initiation, so using marijuana before age 13. We asked about other substance use as well here. This first question, it's the first time we have asked it on our survey. 17.3% of our students are using a prescription pain medicine without a doctor's prescription, or using it differently than the doctor had told them to use it. So we are going to ask that again in 2023 and monitor a trend there. Just 7.7% have used inhalants, 5.3% ecstasy, 5% have ever used cocaine, 3.7% methamphetamines, and 3% heroin. Similar to that, tobacco use, we asked teachers, hey, are you still talking about alcohol use and drug use in your school class, grades 6 through 12? We've seen a decline here as well. It used to be nearly 100% of our teachers taught that in a class. We're down to about 94% now. I'm going to next talk about injury and violence. So we asked questions around driving and automobile behaviors. I was a little bit shocked by this. 40.9% of students said they didn't always wear a seatbelt. 38.3% said they texted or they emailed while driving a car or a vehicle, and that's among students who are able to drive. About 12.3% have been in a car with a driver who had been drinking alcohol, and then 1.1% of students drove a car while they themselves had been drinking alcohol. We also asked these questions around physical fights and bullying. So about 17% of our students said they've ever been in a physical fight within the last year, and then 15% of students have been electronically bullied. When we look at that broken down by gender, we see that females responded more that they are electronically bullied than our male youth. Just looking at this one more way, again, that female youth is higher, but it is more than doubly higher for our LGBTQ population. We also asked our schools if they have a policy on bullying and sexual harassment, especially e-bullying. We're up to about 98.5% of schools who do have a policy on that. What their enforcement of those policies look like, I do not know, and we do not have details on that. We also asked principals if they are offering professional development here around preventing and responding to student bullying and sexual harassment. And again, we see an increase here. So about almost 100% of our schools said they do this. We also asked these questions about bullying, threats, and weapons at school. And these, I just want to say again, was when students were returning to school. So this might not be the most accurate of, did this happen to you in the last 12 months on school grounds? But we did have about 14% of our students say they are bullied on school property. 6% they've been threatened or injured with a weapon on school property. 3% carried their own weapon on school property. About 5.7% said, I actually don't feel safe, on my way to school. So they stayed home. Of those who were bullied on a school property, again, just a slightly higher in our female youth, higher in our LGBTQ population again. Of those who were ever threatened with a weapon on school properties, this is actually, we've seen an increase here in our Hispanic youth compared to all other races and ethnicities. And then of those students who stayed home because they felt unsafe on their way to school, is highest here in our Black youth and our LGBTQ youth as well. The good news is we had about 84.4% of our students say they most of the time, or they always feel safe and secure in their neighborhood. Just 14.8% of students have ever seen someone physically attacked, beaten, stabbed, or shot in their neighborhood. And then 4.8% of our students did not sleep in their parent or guardian's home. So youth experiencing homelessness or the unhoused youth. So next, I will move into the areas that I feel like are the most important takeaways from this survey. And so I'm going to start with mental health. We do ask schools some questions about, are you as a teacher receiving professional development on emotional and mental health in the 2 years before the survey? Again, we've seen an increase here between 2012 and 2020, but still only at 62% of schools who are offering this to their teachers. We also ask teachers if they are increasing their students' knowledge on suicide prevention. Just 86%, again, a steady increase, but not quite at 100% for this one either. And then we also asked the principals, hey, do you have a school improvement plan that includes health-related objectives around this blue line, which is a social and emotional climate, and the green line, which is counseling, psychological, and social services. So again, yes, we have seen an increase, but we are not anywhere close to schools all having policies on mental health related work here in 2020. A reminder here that we asked our schools if, or we asked our students about their mental health. We had 30.7% say their mental health was not good. But this one, every time it hurts every time I read it. 46.9% of our students, almost half of our students, have felt sad or hopeless almost every day for greater than or equal to 2 weeks in a row, so much that they stopped doing normal activities. Beyond that, almost more than a quarter, 27.7% of our students have seriously considered attempting suicide. 22.2% of our youth have made a plan about attempting suicide, which we know is a very clear precursor to an attempt. And we had 11.8% of students who actually attempted suicide. I'm going to break these questions down just a little bit further because I want you all to see here this trend. Of those who said their mental health was most of the time or always not good, higher again in females, higher in our multiracial youth, higher in our LGBTQ youth. Of those who felt sad or hopeless for 2 weeks in a row, so much that they stopped doing normal activities, an increase in both males and females. It is higher in females, but in the past 6 years, we are almost doubling the responses of students saying yes here. Of those who seriously considered attempting suicide, you can see the same trend. I mean, this is an exponential increase here for our youth saying that they are considering attempting suicide. Now, when it comes to making a plan, we see actually a decrease in our male youth and an increase here again in our female youth. And of those who actually attempted suicide, again, a decrease in our males and an increase here among females. I'm going to go through these same questions again. You already saw the male-female breakdown. Please note the bottom columns here. When we ask who felt sad or hopeless, actually a pretty good mix among our race and ethnicities across Indiana, but still double the risk for our LGBTQ population here. When we ask about those who seriously considered attempting suicide, actually see an increase here again in our multiracial youth and our LGBTQ youth. Of those who made a plan, remember again, females are higher, but again, higher in our multiracial youth, higher in our LGBTQ youth. And of those who actually attempted suicide, some of the same trends, highest in our multiracial and our Black youth and our LGBTQ youth here as well. I'm also going to talk just really briefly about those 8 questions we added on adverse childhood experiences. Again, there were 8 questions. I arranged them in highest answered question to lowest, and I'm going to read what each question indicates. So here, our highest response to an ACE is about 37.9% of our students are experiencing a lifetime prevalence of household mental illness. 28.8% of our youth are exposed already to a lifetime prevalence of household substance use. 18.3% of our youth are exposed to a lifetime prevalence of an incarcerated relative. And 13.6% are exposed to a lifetime prevalence of emotional abuse. 8.6% of our students have been exposed to a lifetime prevalence of physical neglect. 8.3% have a lifetime prevalence of sexual abuse with someone 5 years or older than them. 1.9% of our youth have been exposed to a lifetime prevalence of witnessed intimate partner violence between parents or guardians in their home. And then 1.3% of our youth have been exposed to a lifetime prevalence of physical abuse. I just want to show you again the similar trend here of those who reported that exposure to sexual abuse with someone 5 years or older than them, significantly higher risk for our LGBTQ population compared to our heterosexual youth. We also asked 2 questions around racism here. This first one is, do students themselves feel that they were treated badly or unfairly because of their race or ethnicity? You can see the highest responses here in our Black female youth, followed by our multiracial youth. And then we asked as another question of, do you witness racism or unfair treatment among your parents or guardians? So highest here in our multiracial youth and also our Black and Hispanic youth as well. You can see just exponentially higher here compared to our white youth. And then I'm going to next talk about sexual behavior, starting with what I would deem consensual sexual behavior here. So about 31.9% of our youth have ever had sexual intercourse, with about 20.8% of our students currently sexually active. And that's defined by about 3 months before they took the survey. 5% of our youth have had sex with 4 or more partners during their lives, and this is high school youth. And just 1.4% of our students have engaged in sexual activity before age 13. So sort of that early initiation, again, like you saw with the alcohol and tobacco questions. Of those students who have ever had sex, you can see a pretty sharp decline here from about 51% to 31% in the last decade. Of those students who have had sex, you can see this sort of increases between 9th, 10th, 11th, and 12th grade here. And then of those who have ever had 4 or more partners, you can see highest among our senior and female seniors. And then again, that early initiation into sex has decreased from 5% to 1.4% over the last decade. We do ask about contraception use. So about 48.9% of our youth said they used a condom the last time they had sex to prevent pregnancy. And about 42.4% of our youth used some other form of birth control. So pills, an IUD, an implant, shot, patch, to prevent pregnancy as well. 10.8% of our students used both forms, a condom and some other form of birth control to prevent pregnancy the last time they had sex. But almost we had the same percent here, about 9.5% of students who said, I used neither a condom nor any other form of birth control to prevent pregnancy. You can see here throughout high school, as you go through the process, you can see a decline in students using a condom with a reciprocal increase of those using some other form of birth control. And as I'm sure most of you know, Indiana is an abstinence education state, but our schools are required to teach about STIs and HIV. So we do ask if they're being tested. So about 6.9% of students have ever been tested for an STD, not including HIV. And then 5.8% of our students have been tested for HIV. You can see here, this is an increase as students go through high school, with female seniors the most likely to get an STI test. And of those getting tested for HIV, unfortunately, I'm so sorry, we've seen a decline over the past 6 years from about 9% down to about 6%. Now I'm going to talk about the non-consensual sex that we ask our students about. The top 2 questions are just about sexual violence and physically forced to have sex. So 14.2% of our students experienced sexual violence they didn't want to do. And 10% of our students were ever physically forced to have sex when they didn't want to. We ask some similar questions, but specific to those students in a relationship and have someone with a partner. So these 3 questions at the bottom reflect that. 27.4% of our students reported that someone they were dating tried to control them or emotionally hurt them, which is very high. Just 9.8% of students said they experienced sexual dating violence with someone they were dating, someone they were going out with. And then 8.6% of students experienced physical dating violence, again, among someone they were dating. So of those who experienced sexual violence that they didn't want to do 12 months before the survey, you can see here again, higher among our multiracial youth, our female youth, and our LGBTQ youth. Those who are physically forced to have sex is, we've seen actually decrease in our males and an increase in females. And of those who said they were being emotionally controlled or someone was trying to hurt them emotionally, higher in females and higher in our LGBTQ youth. And of those who experienced sexual dating violence, again, higher in our females. Now I'm going to stop here just for 1 second because you all have heard that students are engaged in sexual activity. We also asked our schools on the school health profiles survey if they offer sexual or reproductive health services. We unfortunately have 81.1% of our schools say we do not provide any sexual or reproductive health services. Not only are schools not providing these services in-house on school grounds, they have seen a decrease in schools that are providing referrals to organizations or other healthcare professionals outside of school property that offer services about getting condoms, where to get lube, where to get contraception. In addition, same trends here, we've seen schools are less likely to provide referrals off school grounds for HIV testing, HIV treatment, pregnancy testing, or prenatal care. And I think all of you heard me loud and clear. Our LGBTQ youth are at risk for many different things across the survey. But here I'm just going to highlight just 38% of our schools teach HIV, STD, or pregnancy prevention information that is relevant to lesbian, gay, bisexual, transgender, and questioning youth. And in case you thought students were learning about sex from their parents, you are also incorrect. We've seen a pretty big decline in the past 6 years. Just about 55% of students saying they learn from their parents or other adults in their family what to expect when it comes to sex. And then lastly, I think this one is really important to us and new questions in 2021. We wanted to ask really some questions based on what are students doing outside of school? Who are they connecting with? Who are their peers? Who are their trusted adults? And so we asked some additional questions around extracurricular activities. So this is, we just have about 64% of our students participating in school activities. That includes sports, bands, drama, or other clubs. 39% of our youth, almost 40% of our youth are working in paying jobs. 29.6% of our youth participate in community groups or other activities, so outside of school grounds. And then 28% of our students perform some sort of non-paid community service. We also asked about post-secondary plans. So 64.2% of our students will probably complete a post-high school program, which includes either vocational training, military service, community college, or a four-year college, with about 59.2% of those saying they're most likely going to that four-year college. Some good news here. We have some very trusting parental support here among our youth. 87.8% said their basic needs are met in their household. 85.2% said their parents know where they're going to be and who they're going to be with. 76.7% said they've got consequences for their behavior and there are clear rules in their household. And then 83.6% said they actually feel comfortable seeking help from an adult outside of their parents if they had an important question. Where I'm most worried are these statistics here, which are the last data slides for you. Just 54% of students said they feel close to people at their school, and 50.7% said they can talk to a friend about their feelings. So just feel comfortable talking to a peer. We know that social connectedness is very important, and I don't know if this is a result of the pandemic or if this is a result of social media. We're going to ask these questions again in 2023 and ask a couple more questions about social media as well. And then lastly, just 19.5% of our students said, I most of the time or always get the kind of help they need. So we've got a lot of work to do to get that statistic up to 100% and supporting our youth in any way that we can. And so I will leave you with that. These slides, of course, are welcome to be sent out. They are all on our website at the Department of Health site. Just really quick, lastly, I'm going to talk about our Youth Advisory Board. The Department of Health and the Division of Mental Health and Addiction launched a statewide Youth Advisory Board back in July, but we opened our applications in March of 2021 and crossed our fingers that we had 10 applicants for this. We had 229 applicants for our Youth Advisory Board. And what I really want to stress is that in every single application, all 229 of them, our youth had experienced personally issues at home, mental health challenges, substance use challenges, suicide ideation, a lot of youth with a very honest and open, I want to do this because it's impacted me in my life personally. In July, we did select 45 youth to participate in our first Youth Advisory Board. They represent these counties on the right-hand side that are highlighted in blue. Our youth advisors are board members to the Department of Health. So we meet monthly. We do pay them for their time and their work, a very good pay wage. And our youth over the past few months have decided really what they want to focus on is mental health, reproductive health, minority health, and then access to care. And so they've been great. They've been wonderful. They've given us a lot of feedback and ideas, and we'll continue to work on issues that impact our youth. And then very lastly, I just want to say the participation in surveys like the YRBS and the school health profiles, they are not mandatory. So we get our list of schools and we have to call and ask them to participate. If you feel like you have some influence in your realm or county and want to reach out and see, hey, is there a school here that can help? Please let us know. We never publish the list of schools because it is anonymous, but we might ask for your help if we get to that point. So again, this is some of the only data that we get directly from our youth. We have to survey youth in schools here in the state of Indiana. Always ask that you participate if given the opportunity. And then lastly, like this data and this slides, this is just the first time I've ever had it to work with since I've worked for the Department of Health. And so if there's another way you want to share this, or you want this to look, or you want me to come present to your organization, I'm always happy to do that. Just let us know what's important to you. And that's it. So thank you again for having me. I know there's some questions that I can see popped up, but I haven't been able to see them. This is my email, and I will stop sharing and we can go to Q&A. Thanks so much.
Thank you, Kate. I'm going to share my screen and then we can get to those questions. All right, so Kate, can you see those questions in the Q&A?
Let me get them open. Sorry, just closing some things on my screen. I can
read them as well, just whatever works for you.
Yeah, if you want to read them.
Sure.
Sounds great.
So we've got one that says, are there any questions regarding commercial sexual exploitation?
Yeah, that's a good question. I think there's not. So the questions that I shared today are the way the questions are worded. There may be a question that other states ask specific to that around trafficking. I'd have to go back and look, but I'm happy to see if that's in our 2023 survey.
All right, our next one is, what does lifetime prevalence mean?
Yeah, so Shannon, when we ask questions about ACEs, and so I don't know how familiar you are with ACEs in general. I'm sure you know everything you need to know about them. The ACEs questionnaire is not to be used in anyone 18 and under. It's actually not supposed to be used like a screening tool. So these questions are sort of a proxy for, does this student have an ACE? And so if you look at what the ACEs are, you can have an ACE score of 1, for example, if you have a lifetime prevalence of exposure to mental health issues in the home or challenges in the home. And so that means that already before these students have graduated high school, they are at risk for having 1 ACE or 2 ACEs or 3 or 4. So being where they are, whatever their age is, they've already been exposed to having exposure to 1 or more of ACEs.
All right, our next one is, can you talk about the statewide YAB? Are you all in connection with Vermont YRBS coordinators? They've coordinated a lot of youth advocacy and YRBS.
Yes. Oh my gosh, I'm so glad you asked this. I actually work a lot with Vermont, and I know what they've done with their youth advisor board and their YRBS. They've actually replicated that model in New Mexico. I'm hoping to get us to there in Indiana. Just waiting on it until we get this up and running and figure out everyone's roles and responsibilities. But then, yes, my hope is that they can be some of our biggest advocates with YRBS data. I will say that we had a youth advisory board meeting last night, and I was able to share this exact presentation with all of them. It generated a ton of conversation they feel really inspired in sharing that data with people around the state and having youth perspective on it. So I'm really excited to see where that goes.
Our next one is, I'm curious why you asked about only prescription pain medication misusage and not other medication misuse, like Adderall or Xanax.
Yeah, so how the survey works is we have I think 68 questions. That is a standard YRBS, and then we have to keep, like I said, 2/3 of those questions. Actually, I think there's 85 questions, so we have to keep 2/3. We have to keep around 65, and then we can add up to 99. And the questions that we're able to add, Doug, are ones that have been like tried and tested among the CDC and some pilot projects. And so they know that those questions are valid. So that question at the time was the only one around substance use. And so, like I said, the first time we added it in 2021, I will also double check that there are not other questions around other medication misuse and get back to you though, so.
Great. Our next one is, I'm curious about how the age breakdown is for youth depression/suicide. Is it higher for older youth or younger youth?
Yeah, I am glad you asked. I've actually been doing a very deep dive into these statistics. We had a little bit of pushback from a local health department that didn't believe the statistics were that high. I went back and I did a little bit of a deeper dive. So of our youth, let me see if I can find this. We can break it down by we have youth suicide rates from our Indiana violent death reporting system data. And so when we break it down by ages 10 to 14, the rate of suicide per 100,000 youth is about 4.1. And then our rate of suicide for youth 15 to 19 is actually 14.4. So rate is higher for 15 and older, but we are not immune to seeing deaths by suicide in our 10 to 14-year-olds.
All right, the next one is, do you have any additional insight into the higher rates associated with multiracial youth?
I do not. I'm glad that you asked that question. What I can say is that this is some of the only ways that we can get feedback from youth is through a survey in school or through youth focus groups that we can do with assigned parental consent. And so we're actually going to use our youth first behavior survey data as a launching point for youth focus groups that we're going to be doing starting next year as part of our 2025 Title V needs assessment. So we'll have this data to guide us and maybe even 2023 data to guide us, and then we'll do some focus groups and hopefully have some more explanations there.
All right, I don't see any other questions. I'm going to give it a few seconds. If you have any final questions for Kate, go ahead and send them to the Q&A or in the chat, and we can get those answered.
Oh, I see that Allie's mom is here. Yes, Allie has been leading our youth advisory board for over a year now. We're so excited to have her. She's amazing to work with.
All right, I don't see any other questions. So I think we can go ahead and wrap up. I just want to say thank you again, Kate. I really appreciate you being here, sharing all of your information. Just to wrap up, this is a QR code. There will also be a link sent to your email with an evaluation for this webinar. Any and all feedback is greatly appreciated. If you enjoyed today's presentation and would like to continue your learning, please consider visiting HCET's Virtual Learning at learn.hcet.org. New learning opportunities are being updated regularly. Other than that, this concludes our webinar today. Thank you again, Kate, and thank you everybody for attending. I hope you have a great rest of your afternoon.